Every year, No Shave November gets bigger and bigger. And when it started 9 years ago, it raised $11,000. Last year, Penn State Health and Mid-Penn Bank raised $341,000.
Right, so how did the donations make a difference? Donna Kirker-Morgan found out. Hi, Donna.
Hi, Amy and Deborah. We found out that the money is used to detect prostate cancer. We visited one of the free prostate cancer screening clinics offered at Penn State Health. There, we met two brothers who say they depend on the free screening every year. For John and Jeff Husvar, Penn State Health's free prostate cancer screening clinics have become a family tradition.
It makes it easier, and I know that's our good at screening, so I figured it's worthwhile to make the effort to do it then.
A worthwhile tradition prompted by their father, former NFL player John Husvar, who got screened early and was diagnosed with prostate cancer. He taught his sons how to win the battle against this disease.
Well, he passed away, but not from prostate cancer.
If you think about the many types of cancer out there, prostate cancer, when it's diagnosed early, is the most treatable and it's the most curable. And you won't know you have it unless you have a screening test.
That is why Dr. Jay Rahman, Penn State Health Chair for the Department of Urology, is thrilled to see No Shave November grow in participation and donations. Those funds have been instrumental in doubling the number of free clinics from 2 last year to 4 clinics this year.
The whole purpose of No Shave November is get messaging out about men's health, about cancer screenings, but also to raise money. And raising money is great for education, it's great for research, but we want to invest back in our community.
Penn State Health is also using the No Shave November funds to restart a much-needed prostate cancer support group that was forced to disband due to COVID.
Now we've used the money, and actually we're having our survivorship kickoff event. And I think all of this means that we're actually taking the money that we're raising and we're doing something. And I think that's what's really so important about it.
Important and made possible through a great partnership with Mid-Penn Bank.
So that very first year, the employees contributed money to make me grow a beard. And I think that we raised $11,000.
Each year, it grew and grew. So did everyone's beard. Mid-Penn Bank President and CEO Rory Retrieve says it's been inspiring to see who is now joining the effort.
Each year, we added more pieces. So some of the doctors from the urology group started to chip in the second year. And we started going out and getting other people outside of the company to contribute money.
And as we watched dozens of men roll up their sleeves to be tested, it was easy to see how No Shave November is getting men in the doors to get screened.
Like sometimes you raise money for people or raise money for organizations and you give them the money and you don't see quite how they're utilizing it. But in this instance, we know that they're doing things like this tonight.
I think the great thing about free prostate cancer screenings is, number one, sometimes it helps men who maybe don't have insurance, and so it allows them an avenue to get in. The other is, honestly, sometimes it's just easy when there's an event and it's free for men to just come to it.
The Husvar brothers left this year feeling confident they are doing everything possible to stay healthy, and John says, with the family history of prostate cancer, he will pass this yearly screening tradition on to his sons.
Yes, and I'm going to recommend to my 2 younger sons that when they get to that age of 50 that they come out here and get this done too.